My name is Karen Pike. I'm an emergency physician practicing in San Jose, California, where I've been at this for 20 years. Happy to be here to talk to you a little bit about staying safe under the time of coronavirus. The most common coronavirus symptoms are cough, fever. Those are probably the top two that most people have. You may also get things like headache, muscle aches, nasal congestion, sore throat. And then there's been some latest talk about sometimes losing a sense of smell or taste, maybe a symptom. A cold is just nasal congestion, no fever. That's probably not coronavirus. Allergies, itchy, watery eyes, no fever, minimal cough, that's probably not coronavirus. Coronavirus is going to be a cough, chest pain, shortness of breath, fever, something that goes on for over a week and you get pretty sick. Everyone's at risk for contracting the coronavirus, but the younger and healthier you are, the less likely you are to get very ill from it. But right now it's stay home. Minimize your exposures. When you're at work, then you want to stay 6 feet apart from your coworkers and do everything you can to minimize contact, whether it be washing your hands very often. The number one thing we can do right now is social distancing. Face masks can be very helpful. If you are sick and coughing or don't even realize that you might be sick, it will prevent any droplets from being shared with others, so it can keep others from getting sick. In addition, it may help as a touch point to prevent you from touching your face, which is one way that we can transmit the disease to ourselves. So it can be a nice reminder. There's been studies in laboratories which have shown that coronavirus can last on the surface for multiple days, but we don't understand how long it's actually infectious. So the bottom line is just keep the surfaces clean. Whenever you touch surfaces that are touched by other people, wash your hands, don't touch your own face, and just do everything you can to minimize exposures, because this is really a bit of an unknown right now. You are at greater risk if you smoke or vape. Anything that you do which is unhealthy for your lungs puts you more at risk for developing more severe COVID-19 disease. But right now, I think everyone should do everything they can to keep themselves healthy, and this would be a great way to do it. Stop smoking. No, you're not going to get coronavirus from your dog. Your dog can provide a whole lot of comfort during this stressful time, so keep your dog. Considering the line of work I do, I'm washing my hands probably 40 or 50 times a day between patients. For everyone else, when you're out, I would say try to use hand sanitizer and wash your hands very regularly. You can do things like set your watch to remind you to do it every 30 minutes, every hour. Those might be good ways to remind yourself to wash your hands often. If a friend or a family contact gets COVID and you live with them, you are at increased risk because you're in close contact. So things you can do in those circumstances are make that person be sure to wear a mask, put them in a separate area of the house where they can have their own bathroom and they can be isolated, and do everything you can to minimize contact with that person. Well, we have to shop. I mean, that's a necessary thing. We like to minimize going grocery shopping maybe once every 2 weeks would probably be a reasonable goal. You want to minimize how much time you spend in the store, so have a shopping list ready to go. If you want to wear gloves while you're in the store, that's fine. You can discard them after your trip. I would definitely sanitize the shopping cart while you're in the store and stay 6 feet from everyone else. I do not think you should get a haircut or go to the dentist right now, especially the dentist, unless it's an emergency and you've got a real infection or something that needs to be urgently treated. That is a treatment where you're in close contact with a provider, and we'd like to minimize those as much as possible right now.